and welcome to the show. Today we are in conversation with Dr. Murli Rao. He is currently the professor and chairman at the Department of Psychiatry and Behavioral Neurosciences at the Loyola University Medical Center in Chicago. He is also the founder of the National Network of Depression Centers at the India Foundation, the NNDCIF. Welcome to this conversation, Dr. Rao, especially today when it is, we had, it's the National Mental Health Day, I think. Mental health is something that we're really focusing on during COVID times. It's, I think, one of the corollaries of the pandemic, really. The focus has been on the mental health and the well-being. So can you begin with just explaining what exactly what is the situation right now? Do you see people being more stressed because of the pandemic? Is it only the obvious social and financial fears, or is it something else that is also triggering off the mental stress?
Absolutely. Actually, today is World Mental Health Day, and this particular mental health day is coming in such a time. Our daily lives are completely changed, for some considerably changed as a result of this COVID-19 pandemic. And it has brought on challenges that we never had imagined, particularly the healthcare workers and then providing care in difficult circumstances. And they have to take care of the family and then the patients and make sure that they keep everybody safe. The students having to adapt to video learning and classes from home, little contact with others and teachers, particularly anxious about their future, what's going to happen. And workers, most importantly, whose livelihood have been affected because, all professions cannot practice by video or IT. Many have to do, like restaurant workers and healthcare providers. You have to come in contact, and so a lot of people have gotten into this state of poverty because of this. We saw mass migration. I was reading about it from big cities to the villages and back to big cities because they needed to.
Life as we know it is not working. Now we have to find out the new normal, and that's what's causing a lot of stress.
Absolutely. And especially those who already had mental health conditions like anxiety and depression, for them, isolation is not a good thing, but they really got worse. I mean, we have never seen a demand for mental health like this. And this is not this is only the beginning. I think this will last for several years. The traumatic period, post-pandemic period. Already we are beginning to see people have recovered from coronavirus. This is are having the aftermath of the disease. It's not just you lived it, you survived, you're still alive, but it does so much damage to the nervous system, heart, and people are left with disabilities that they have to suffer for a long time, especially breathing conditions. So it has got an impact on so many things which we are learning as we go. First we wanted to just save lives. Now it's going further. Now,
can you help me understand, is there any precedent in this? We had SARS earlier, we've had pandemics, we've also had 9/11, 26/11, we've had, incidents that can lead to stress. Is there any comparison that you can make? Do we have a precedent?
That's a real excellent question, because what's different from other pandemics we had, epidemics actually, pandemic of this proportion, never in our lifetime, because it was Spanish flu 100 years ago. So, if we look at the disease itself, it's very devilish disease, and it is a very versatile disease. It keeps on changing. It's attacking all body systems, and doing all kinds of damage to the body, lungs, like I was telling you, lungs, heart, liver, and kidneys. And it doesn't attack the mind directly, but the pandemic virus has been totally devastating to the mental health.
A lot of drug and alcohol abuse also, because
because people don't know how to, those who are not very organized and planned, they don't know how to multitask at the same time. You're doing your work, and
What
there's
are
no
the
burnout.
solutions? You've told us what is the problem. Now, what are the solutions?
Solutions
What do you
is,
advise people? Huh?
yeah, solutions are not easy, but uh, how to raise our resiliency, right? So on one hand is stress, on the other hand is resiliency. That should be balanced. And how to build up resiliency? Um, there are few things one can do. Is first thing is to accept the situation that this is happening and we have no control over it. Accept the uncertainty. Accept that the situation, and if you accept the situation, that will release your energy to focus on other things, and instead of just uh, being a worrywart and keep on thinking about what we cannot do. And since this is an uncontrollable thing, focus more on things that you can control. You can control your daily schedule. You can control self-care. You can control taking care of yourself and taking your uh, immediate family, neighbors, elderly in the neighborhood, because COVID is really affecting most seriously the elderly.
What are
Of
the medicines that you? A lot of people must be going in for antidepressants. Is that a good thing? Is it a bad thing? Are you in favor of it?
Well, depending on the severity of the depression, if it is a situation like all of us going through, um, I mean, talking and being in connection with people, not to isolate further by whatever media available. That's the first course. And second thing is that there are so many agencies that have come forward, including NNDC India Foundation. There are 100 volunteers who are willing to counsel and make you feel that you're not the only person, and give some strategies of how to cope with that. So medication becomes necessary when the depression is really severe. And
Have you had a lot of cases where there are deaths due to depression? I was reading somewhere there was a study saying that there has been an increase in that also.
Absolutely, absolutely. I mean, I never seen like our department. We During COVID, we performed like 125% of our highest achieved targets ever, because everybody was trying to accommodate few more, because now it's all telehealth anyway. So we have seen a lot more patients, and I do hospital psychiatry. I've seen an increase in domestic abuse. There is an increase in drug overdoses and teenage suicide attempts like never before. This is a drastic change, because people are struggling to to cope with it. Of course, they go to things that uh, like drinking, smoking, whatever habits they had. So they start doing more because of their time on their hand. They're worried. Um, so lots of things, lots of factors put together is causing so much of emotional distress. And then instead of carrying on with our beliefs, we are deviating as a compensatory mechanism. And so to fall back on the track should be our goal. So there are few things we can do to reach out to others.
Quickly,
And
we're
you know
getting
what?
out of time. So can you quickly just tell us what are the things you can do?
Okay, reach out to others. Don't feel lonesome. Invest in self-care, and regularize body care, mind care, whatever works for you, whether it's spiritual, religious, meditation, whatever. So look for meaningful and purposeful activities, and stay motivated, whatever it takes, by stopping the worrisomeness and focus on something and achieve small bits. And that way you can steer away and keep focused on a better life. Yeah.
Thank you, doctor, for having this conversation with us. I think one way to combat the depression or the side effects of COVID, as you said, is channel yourself, focus on your inner self, small achievable goals, anything that makes you feel good, and hopefully something that is not a substance abuse. I think that's sums it up.
That's correct. Yes.
Thank you so much for having this conversation with us. Thank you,
Oh,
doctor.
thank you. It was very nice of
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.